Hello, my name is Alex Beckman, and I'm here to talk to you about a nurse's perspective in religion and religious clients. We as nurses are trusted to care for people. We aren't simply there to start medications and fix physical problems, but are often the bridge between the cold science of disease and the humanness of illness, suffering, and healing. When we care for a patient, we must consider that we are also caring for the spiritual and emotional as well as the physical well being. This is the core concept of this class, how we as nurses intend to interact and care for people of all kinds of different faith backgrounds and belief structures. Our clients' beliefs don't simply dictate where they go to worship, but in many cases dictate many aspects of their life, including the medical treatment. The most famous example of religion dictating medical care is the new religious movement of the Jehovah's Witness sect of Christianity. It is forbidden for them to receive a blood transfusion, even in the case of where it is their own blood taken, stored, then transfused back to them in an auto transfusion. This extends even possibly to life threatening circumstances. In this case, it falls on the healthcare team to educate the client about the risks of treatment without the possibility of transfusion, then come up with ways to treat these patients. In fact, in recent years, the push to care for Jehovah's Witnesses has forced medical scientists to advance treatment without blood transfusions. As a nurse, it is important to care for those patients with the same respect as all of our other patients. It is not our place to interject our personal opinions about the client's medical decisions. The best we can do is listen, understand, and educate the client. There are many different religions in the United States, and for the most part, the religiosity of the client doesn't dictate their medical options. For example, we will most likely treat a Jewish client with the same medication for heart failure as we would a Muslim client. Where the religious where the religion of the client comes into play is most often how they apply meaning and sense to the hope and suffering in the difficult times. Christians involved in our care may have to wrestle with the idea that a good God would allow such suffering in their lives. At this point, it is our job as nurses to listen to our client and give them the opportunity to express their feelings about suffering, their beliefs, their reasoning, their anger, and all the emotions they have at the time. We aren't there to provide reasoning for suffering, and is referenced in Religion, a Clinical Guide for Nurses by Elizabeth Taylor. We should only offer our opinion if asked directly, and even then only under certain circumstances. When the subject comes up, we should make sure that we are able to confidently answer the question. For example, I wouldn't feel comfortable answering questions about suffering and the afterlife for a believer of the Hmong religion. I am not versed well enough in their animistic beliefs to give a comforting answer even if asked. I can, however, be a resource to the client and arrange a call with the elder of the community that may be able to answer their questions better. I believe that the best way to gauge a client's specific religious beliefs, special considerations, and religious practices is simply to ask them upon admission. At this point, I'll be able to assess the religious and cultural background of my clients. For example, if my client is female and indicated that they were a devout Muslim in their faith, I would be able to take this opportunity to ask if they would be comfortable with male caregivers. Elizabeth Taylor points out that the propensity for modesty in the Islamic religion makes some believers resistant to be cared for by men who are not their husbands. A simple question about their faith and how we can make the patient more comfortable can go a long way to establishing trust between the client and the healthcare team, especially the nurse who will have the most contact time with the client. Ultimately, the nurse is there to take care of the patient, and this includes their physical, emotional, and spiritual health. Having an in depth look at how we as nurses can interact spiritually with our clients makes us better and more complete nurses. Thank you for listening to this presentation about the nurse's role on religion and religious clients.